We sit down and get up from the office chair numerous times a day. There are biomechanically correct and incorrect ways of doing this. The incorrect way is when the pelvis is tilted forward and the spine is rounded. Every unnecessary bending of the spine can cause small mechanical damage over time. This flexed position of the back can lead to structural and functional changes in the anatomical structures of our back. The correct way of sitting down and getting up from the office chair involves keeping the back straight, performing the lowering movement at the hips, and sitting down softly. Automated correct ways of sitting down and getting up help can prevent overstrain of anatomical structures, as well as the occurrence and progression of mechanical damage, thus preventing back pain. It is incorrect if, when sitting, body mass is not evenly distributed on both sitting regions. Right-handed people often put a little more strain on the left gluteal region. Due to this way of sitting and the uneven load on the bones, joints, muscles, tendons, ligaments, etc., scoliosis can occur. When sitting, body mass should be evenly distributed on both sitting regions. It is not incorrect to sometimes put a little more load on one sitting region, and then on the other. In this way, we evenly load the bones, joints, ligaments, muscles, and tendons. Whenever possible, a person should evenly distribute body mass or at least change the load from one side of the body to the other. The most common incorrect sitting posture is sitting with a flexed spine. The joints of the spine are then in an incorrect position, the intervertebral discs are asymmetrically compressed, and they are pushed towards the nerve structures of the spine. Due to the continuous stretching of the ligaments, the spine becomes loose. This way of sitting can be called a pre-workout disc herniation. When sitting, the pelvis, sacrum, and entire spine should be in the same plane as seen from the side view. Correct sitting ensures an equal and stable intervertebral space, pressure forces on the intervertebral discs are evenly distributed, and unnecessary stretching of the ligaments and muscles of the spine and back is prevented. This preserves the stability of not only the lower back, but also the entire spine. It is not correct to flex the lumbar and thoracic parts of the spine while sitting and reaching for a distant object. If such an incorrect movement pattern is continuously applied, the posterior ligaments of the spine can become irreversibly stretched, and the spine itself can become asymmetrically loose, which can cause pain not only in the lower back but also in the leg. Therefore, every leaning of the trunk and tilting of the head forward should be executed with a straight back, and the axis of trunk rotation in relation to the legs should be in the hip joints. In this way, all bone joint and muscle tendon systems perform their functions, those functions for which they were primarily created. In this and other similar situations, this proper movement pattern is a mechanism for preserving the health of the lower back. While sitting and working, a person often turns to the sides. It is incorrect if the legs remain glued to the floor while the upper part of the body rotates. In this case, the lumbar part of the spine rotates around longitudinal axis, which is not how it is designed to function. Performing such incorrect movements can lead to various mechanical damages to the anatomical structures of the lumbar spine. The correct approach is to start the rotation with the legs, allowing the entire body to follow. The main function of the lumbar spine is to transmit forces. It is not intended for rotational movement. The lumbar spine should remain stable, without rotations around its axis. Consider how often you rotate the lumbar spine around its axis each day. In situations where the worker needs to turn sideways while sitting, two common incorrect compensatory movements occur. The first incorrect compensatory movement involves the rotation of the lumbar part of the spine around its axis. The second incorrect movement involves the rotation of the cervical part of the spine around its longitudinal axis by more than 80 degrees. There are two correct movements and ways of turning while sitting and working in the office. The first proper movement is when the rotation starts with the legs, allowing the whole body to rotate simultaneously. The second proper movement is the rotation of the thoracic spine around its longitudinal axis. Unlike the lumbar spine, the thoracic spine is designed for rotation around its longitudinal axis. The first mechanism of injury to the lower back is spinal flexion, and the second is rotation of the lumbar part of the spine. The third mechanism of injury, which is the most dangerous, is a combination of the first two mechanisms of injury and is shown in this video clip. This mechanism of injury occurs when the worker bends forward and rotates lumbar part of the spine to do something. The movement of bending forward and rotating the body can be done in a correct or incorrect way. During the correct way of tilting and rotating the body, the lumbar part of the spine must remain in a neutral position. The rotation should start with the legs, and the trunk should tilt forward at the hip joints. In this way, the intervertebral space and thus the intervertebral discs are preserved. Unlike the lumbar spine, the thoracic spine is built for rotation around its longitudinal axis. We have all heard that it is good to have support for the back when sitting. In principle, this is true, but it may not be suitable for everyone. It is up to us to decide whether and how to adjust our office chair based on our sense of comfort. Our sense of comfort mostly depends on our postural characteristics, primarily the position of the pelvis. If we look at a person from the side, we can see that their pelvic position can have an anterior tilt, a posterior tilt, or it can be in a neutral position. For an anterior tilt of the pelvis, slightly higher support for the back is suitable. In fact, it is support for the part of the spine where the lower part meets the chest part of the spine, the lumbothoracic part. For people with a posterior pelvic tilt, the most suitable support for the back is set a little lower. It is support for the lumbar part of the spine and back. People with a neutral pelvic position can place the support either lower or higher, depending on what is comfortable for them. Highlighted protraction of the neck and head is a particularly dangerous and very common incorrect position of the body while working on the computer. This position of the neck is the result of a flexed spine. The consequence of a flexed spine and neck and head protraction can inhibit the normal function of the circulatory system. Because of this, a person may feel weak, dizzy, and have foggy vision, etc. The correct position of the neck and head while working on the computer implies that the cervical spine is a natural extension of the thoracic spine. The thoracic and cervical spine should maintain their natural curvature. This position enables the normal operation of the blood vessels in the neck and head area and reduces muscle tension in the neck, shoulders, and arms. It is incorrect to rotate the head to the side by more than 80 degrees. Also, it is incorrect and dangerous if such rotation always happens in the same direction. It is especially dangerous to rotate the head by more than 80 degrees when the thoracic spine is flexed, and the cervical spine and head are in protraction. This movement can directly inhibit the function of the circulatory system in the neck and head. The cervical spine is made for rotation, but these rotations must not exceed 80 degrees. Any rotation of the cervical spine should be performed from a neutral position of the spine. It is recommended to avoid always rotating in the same direction. Also, it is recommended not to rotate only the neck, instead, rotate the neck and thoracic spine together. In situations when a person is on the phone, it is incorrect to hold the receiver with the head and shoulder. The three most common mistakes are: the first mistake is when the head is tilted to the side by more than 45 degrees. The second mistake is one-sidedness. The third mistake is when lateral tilting of the neck is done from the position of a pronounced arching of the thoracic spine. It is correct to avoid tilting your head to the left or right. There are two ways to avoid side tilting of the head and neck while simultaneously talking on the phone and working on the computer. Hold the phone with your hand, not with your shoulder and ear. Use earphones to avoid neck and head tilting movements. It is incorrect if the height of the chair seating area is too low. Such a position results in a considerable movement of the upper arms away from the body and causes unnecessary activation and tension of the shoulder, upper back, and neck muscles. The seating area of the chair must not be too high either, as this causes the spine to flex, the shoulder blades to spread, and the shoulders to rotate internally. The height of the chair seating area should be set so that the forearms are at least level with the table. This allows the upper arms to be next to the body and the shoulders to remain relaxed. A properly adjusted chair height provides the precondition for proper sitting, which can reduce fatigue and tension in the muscles of the shoulders, upper back, and neck. Internal rotation of the forearms and hands, as a potential mechanism of injury, most often occurs as a result of internal rotation of the shoulder. Internal rotation of the shoulder typically happens due to pronounced flexion of the spine. Pronounced flexion of the spine is usually caused by incorrect use of the hips. A hip flexion and a straight, neutral position of the spine and back are prerequisites for external shoulder rotation. External rotation of the shoulder is also necessary for proper semi-external rotation of the forearms and hands. To achieve correct semi-external rotation of the forearms and hands, using a split keyboard can be helpful. When working with a computer mouse, it is necessary to avoid internal rotation of the forearm and hand. Pronounced internal rotation of the forearm most often occurs as a result of internal rotation of the shoulder. When a worker has problems, or even before issues arise with the forearm and hand, it is advisable to ergonomically adjust the workplace. Ergonomic adjustment of the position of the forearm and hand can be achieved by using a vertical mouse. The external rotation of the shoulder and the semi-external position of the forearm and hand during daily work with a vertical mouse can be effective preventive measures against musculoskeletal syndromes in the forearm and hand. Sitting with crossed arms and legs should be avoided as it can lead to posterior pelvic tilt, flexion of the lumbar spine, asymmetric compression of intervertebral discs, damage to peripheral nerves, head and neck protraction, occurrence of varicose veins, muscle, tendon, and ligament imbalance, development of a kyphotic posture, increase in blood pressure, overall muscle imbalance. Correct and safe sitting implies that neither arms nor legs are crossed. Occasionally crossing your arms and/or legs is acceptable, but it is incorrect to do so daily, often, and continuously. On the one hand, we highlight the importance of strengthening muscles and improving balance and stability. On the other hand, careless body positioning directly leads to exercises that promote muscle laxity and unnecessary joint mobility, which directly inhibit the overall body balance and stability. The most common incorrect body postures and movements while sitting and using a mobile phone include holding the mobile phone close to the abdomen, pronounced spinal flexion, protrusion of the neck and head forwards, shoulders raised and in a position of internal rotation, shoulder blades spread apart and raised. Such positions of the back directly cause muscle tension and pain in the neck and back. The correct body postures and movements while using a mobile phone in a sitting position are as follows. Hold the mobile phone at chest level. Keep the spine straight. Ensure the neck and head are an extension of the spine. Keep the shoulders down and in the external rotation position. Keep the shoulder blades close together and down. The longer we spend with a mobile phone in our hands, the greater the importance of maintaining correct body postures and movements during its use. The most common mistake is pronounced forward tilting of the head and neck, the so-called text neck. It is incorrect if the spine flexes when using a mobile phone. Any deviation of the lumbar, thoracic, and cervical spine from the normal neutral position can lead to overstrain, degenerative changes, pain, and issues with other parts of the locomotor system. The neck part of the spine should predominantly be in a neutral position during standing. A precondition for the cervical spine to be in the correct position is the correct alignment of the thoracic and lumbar spine. Everyday tilting of the head and neck forward by flexing the spine should be avoided as much as possible. Tilting the trunk forward from a standing position should be done at the hip joints. From a standing position, we often tilt over the table to write something down or to look at something, and we flex the spine and back, which is the most common mistake. We usually hold this position for a very short time, so we think that it does not matter. However, this movement, in combination with numerous other instances of flexing the spine, strongly contributes to the occurrence of overexertion syndrome and can lead to pain in the back, neck, and other areas. When tilting the trunk forward, the flexion should be done from the hip joints. The back should be straight, and the cervical spine should be in a neutral position. This is perhaps the most important movement to adopt. When we perform this movement correctly, it can be seen as an exercise to strengthen the back muscles. However, when done incorrectly, it can cause weak back muscles and a loose spine prone to injuries. The squat and its variations can be done correctly or incorrectly. Incorrect squats can be dangerous not only for the back but also for the knees. It is dangerous for the knees when body mass is on the forefoot and when the knees considerably exceed the line of the toes. The following are some variations of incorrectly performed squats in which the spine bends. Spinal flexion is one of the main mechanisms of back injury. It is also a key mechanism for disc herniation. For a small number of repetitions, the correct squat is completely safe, not only for the back, but also for the knees. In a proper squat, the knees do not significantly exceed the toes, and the body mass is on the heels or evenly distributed across the whole foot. Some variations of regular squats follow, in which the spine does not bend, and the spine and back remain straight. A straight back is the main mechanism for keeping the spine healthy. The straight back ensures equal and stable intervertebral space, and the pressure forces on the intervertebral discs are evenly distributed, which prevents unnecessary stretching of the ligaments and muscles of the spine and back. This preserves the stability of the spine. No matter which squatting technique you use, you should avoid flexing your back. The deadlift and its variations can be performed correctly or incorrectly. Incorrect performance of the deadlift involves spinal flexion, which is a significant mechanism of injury. The risk of injury and pain can increase with the number of repetitions, weight of the load, speed, and amplitude of movement. Spinal flexion occurs because it is easier, body mass shifts onto the ligaments, and the muscles work minimally. Various deadlift variations exhibit one common factor: spinal flexion. Spinal flexion is a primary mechanism of back injury and a key factor in herniated discs. Flexing the spine leads to muscle imbalances, and it has been scientifically proven that muscle imbalance is present in 100% of cases of low back pain. To avoid muscle imbalance and ensure proper tension in the spinal ligaments, it is essential to learn and automate the basic deadlift technique. This technique ensures a straight back and stable intervertebral space. Once this technique is mastered, it is crucial to apply the correct trunk tilting technique in other deadlift variations as well. Regardless of the deadlift variation used, the axis of rotation must be at the hip joints. The gluteus muscles and hamstrings are the primary agonists in this proper hip hinge movement. This means that every correct trunk tilting movement strengthens the muscles of the buttocks and legs. No matter which deadlift variations you use, you should avoid flexing your back. An incorrect rotational movement primarily refers to the rotation of the lumbar spine around its longitudinal axis. During this rotation, the following can occur: compression, irritation, and wear and tear of cartilage tissue, stretching and loosening of ligaments, compression and pushing of intervertebral discs, etc. Altogether, these factors can result in a loose lower back prone to injuries. The correct way of rotation involves the simultaneous start of rotation in both the upper and lower parts of the body. The first rule is that the rotation starts with the legs. At the same time, the legs, pelvis, and torso should rotate together. In other words, the rotation should originate from the legs, not from the lumbar spine. In such situations, only rotation of the thoracic spine is allowed and preferred. The incorrect trunk tilt and rotation movement primarily refers to the simultaneous flexion and rotation of the lumbar spine. This is a particularly dangerous movement because it causes asymmetric pressure and pushing of the intervertebral discs against the nerve structures while simultaneously reducing the intervertebral space. For the lumbar spine, this is perhaps the most dangerous mechanism of lower back injury. During the correct way of tilting and rotating the body, the lumbar part of the spine must remain in a neutral position. The rotation starts with the legs, and the trunk tilts forward from the hip joints. This method preserves the intervertebral space and, consequently, the intervertebral discs. In this way, each bone joint and muscle tendon system performs the functions for which it was created. When raising the arms above head level, insufficient mobility in the shoulder joints, thoracic spine, and hips often leads to compensatory movements in the lumbar and cervical spine. Compensatory movements refer to hyperextension of the lumbar and cervical spine. The less mobility there is in the shoulder joints, thoracic spine, and hips, the greater the compensation in the lumbar and cervical spine. To prevent compensatory movements in the lumbar and cervical spine when raising the arms above the head, it is important to gently engage the abdominal muscles. Another way to avoid this issue is to refrain from handling objects placed very high if we lack sufficient mobility in the shoulder joints and thoracic spine. Instead, objects should be kept at a lower level, or we should use a step stool or ladder. Backpacks and satchels that we carried during our schooling have now been replaced by bags, laptop bags, etc. It is incorrect to always carry bags on the same shoulder or in the same hand in the same way. The consequences of this can be that the shoulder on which we predominantly carry the bag becomes higher than the other, scoliosis of the spine can occur, muscle imbalance, muscle tension, and soreness, etc. Regardless of the kind of bag we carry, we should try to frequently change the hand or shoulder, even when the bag is very light. Think about how you carry your bag. Do you always carry it in the same hand and on the same shoulder? If you have noticed that one side is predominant, try to change it. Motivate yourself to carry the bag on the other shoulder or in the other hand for a while. Standing can be seen as a daily activity that can potentially lead to degenerative changes, but it can also be a preventive activity that helps preserve and improve the health of our bones, joints, and muscles. In the case of incorrect standing, the ear, shoulder, hip, knee, and ankle are not vertically aligned when viewed from the side. It is incorrect if the backs of the hands face forwards. Additionally, it is incorrect to always place the predominant body weight on one leg. When standing correctly, the ear, shoulder, hip, knee, and ankle are vertically aligned when viewed from the side. It is correct if the backs of the hands face outwards, with the palms facing the body. It is also correct to evenly distribute body weight on both legs and to alternate standing on one leg and then the other. The most common mistake when walking is spinal compression, which makes us shorter than our normal height. When walking, we should strive to be as tall as possible. The spine should be in a neutral position, which enables its decompression. The thoracic spine should not be tilted forwards. It should be upright, with its natural physiological curvature. The neck and head should not protrude forwards. The cervical spine should be an extension of the thoracic spine, meaning the head is held back with the chin slightly tucked. The gaze should be directed about 5 meters in front of you, not at the floor. The shoulder blades should tend to join and be low. Avoid raising the shoulders and rotating them internally. Instead, the shoulders should be down and externally rotated. It is incorrect if the backs of the hands face forwards, with the palms facing back. Correct posture has the backs of the hands facing outwards and the palms facing the body. For those with a posterior or anterior pelvic tilt, it is incorrect to emphasize this tilt even more during walking. The goal is to achieve a neutral position of the pelvis and spine through proper muscle activation. Inactivity and relaxation of the buttock muscles during walking contribute to overall passivity of the musculoskeletal system. To make walking more efficient, alternately contract the buttock and hamstring muscles of the supporting leg. Relaxation of the abdominal muscles also contributes to overall passivity. Simultaneous contraction of the lower abdomen and alternating contractions of the buttock muscles contribute to trunk stability. It is incorrect to walk by dragging your feet on the floor, as this is a common cause of tripping and falling. Lift your feet off the floor, with pronounced flexion in the hip, knee, and ankle, to reduce the likelihood of falling. This is especially important for fall prevention in older adults. Taking long strides emphasizes compensatory movements, so steps should be shorter with a higher frequency. Adequate arm movement is also important. Arm swings should be coordinated with leg movements, right arm with left leg and vice versa. Strive to increase the range of motion of the arm swing over time. The lower back, lumbar spine, should remain stable and firm during walking, achieved by gently activating the lower abdominal muscles as if expecting a light blow below the navel. Finally, it is incorrect if there is no rotation of the thoracic spine around its longitudinal axis during walking. Proper walking involves this rotation to maintain balance and posture. Walking in high heels is not just walking, it is a skill, an art of controlling forces while moving the body's center of gravity on a reduced support surface. Walking in heeled shoes can be done correctly or incorrectly. If a person lacks sufficient range of motion in the hip, ankle, and foot joints, an awkward way of walking can occur. This can lead to compensatory movements, increased curvature of the spine, and the accumulation of microtraumas. These issues are most experienced by women with an anterior pelvic tilt and pronounced lumbar lordosis. One of the consequences of years of wearing high heels is the shortening of the calf muscles and the Achilles tendon, which can interfere with normal walking in flat shoes. Proper walking in heels requires a greater range of motion in the hip, ankle, and foot joints. This range of motion can be achieved through stretching exercises. Here are several exercises designed to facilitate walking in high heels. Hip flexor stretch. Quadriceps stretch. Stretching of the foot muscles and increasing mobility in the ankle. Calf muscle and Achilles tendon stretching. Stretch to the limit of pain and hold for 10 seconds. It is incorrect if the height of the kitchen chair is not adjusted to match your body height and the height of the kitchen table. The most common mistake is having the chair set too low, which causes the trunk to flex forward. The upper arms to be significantly pulled away from the body. When sitting at a kitchen table, the height of the chair should be adjusted so that your torso remains perpendicular to the floor, and your upper arms stay close to your body. If needed, you can use additional pillows to adjust the chair's height. This ensures proper alignment and comfort while working at the table. Using a laptop without an additional monitor and keyboard should be considered an occasional solution, not for regular use. When the laptop is placed on a table, the top edge of the screen is typically well below eye level. In this position, the user tends to flex their back and push their head and neck forward to see the screen properly. To correct the height of the laptop screen, place an elevation under the laptop, such as several books. This setup requires an additional keyboard and mouse to be functional. In other words, raising the laptop screen to the correct height is only practical if an additional keyboard and mouse are available. Using the laptop in this position allows for the use of its keyboard and mouse, but the position of the screen is extremely harmful. Working under these conditions inevitably leads to significantly greater fatigue in the muscles of the neck, back, and shoulders, increasing the risk of degenerative changes. When we need to work on a laptop without an additional keyboard, mouse, or monitor, we can incline the laptop using several books, holders, or other forms of elevation. Raising the height of the laptop screen is necessary not only for longer periods of use but also for shorter periods of time.